Typhoid fever. Typhoid fever is common in underdeveloped countries due to poor sanitation and hygiene measures.
Subscribe and like. Signs and symptoms can be very mild to severe.
Like on and off diarrhea with no or low-grade fever.
To severe fever, vomiting, cough, tummy pains. Classic presentation.
Fever.
Malaise.
Pain in abdomen. And constipation.
If it gets worse, then one can have fits or seizures, confused state or sleepy all the time,
Disoriented.
intestinal perforation or hemorrhage. Untreated can lead to death within a month as well. It has two types.
Salmonella enterica is serious type.
Paratyphi B and C to lesser extent.
Mode of transmission. Type 1 typhoidal salmonella. Contaminated food or drink oral transmission. Not washing hands after using toilet hand to mouth. Contaminated water or undercooked foods. Shellfish. Type 2 paratyphi. Contaminated street food. This type feels extremely suitable to grow. Classic typhoid fever syndrome. Incubation time.
Symptoms appear normally 7–14 days after ingestion.
Week 1.
Tummy pain and tenderness, right upper quadrant. Can develop cough, headache, constipation, confusion.
Then starts fever stepladder only in 12%. Steady insidious onset most of the time.
Maculopapular rash, rose spots.
1 to 5 centimeters in size and disappear in few days.
Symptoms in second week. Abdomen starts getting bigger or distended. Splenomegaly. Slow heartbeat or bradycardia. Heart beating starts getting weak or diaphragm. Symptoms of third week.
Patient gets weaker and weaker.
Pallor complexity. Poor intake or anorexia.
Weight loss. Confusion or laziness. Green-yellow smelly stool.
Intestinal perforation.
Toxemia.
Myocarditis. Death may occur as well. Symptoms in fourth week. Slow improvement of fever, appetite, and state of mind.
Weakness may take quite a few months to improve.
Some become carriers of S. typhi to transmit to others.
Atypical manifestations. Mild to severe headaches.
isolated muscular pain or arthralgia,
jaundice, pneumonia,
urinary tract infections,
or fever alone. In extremely rare cases,
Parkinsonian symptoms develops,
or Guillain-Barré syndrome. Complications include
pancreatitis,
meningitis,
orchitis, osteomyelitis,
pus or infection. Diagnosis include
blood culture during first week,
agglutination test or antibody test in second week,
stool culture in third week,
A&D urine culture in fourth week. Cultures are 100% specific tests for enteric fever.
Other laboratory findings include moderately anemic, thrombocytopenia, lymphopenia,
Increased ESR or CRP,
increased bind APTT, decreased fibrinogen, increase ALT-ALP, increased bilirubin,
hyponatremia,
hypokalemia,
eosinopenia, ALT-to-LDH. Greater than 9:1 is viral hepatitis and less than 9:1 is typhoid hepatitis. Management.
start antibiotic ASAP to avoid any complication.
In non-complicated typhoid,
azithromycin per oral,
cefixime per oral, ciprofloxacin per oral,
in complicated typhoid, ceftriaxone injection,
vancomycin injection,
meropenem injection,
ciprofloxacin injection,
decadron or dexamethasone to reduce mortality and complications,
strict hand-washing techniques,
to avoid preparing food for others during the illness course. Hospitalized patients should be placed in contact isolation during the acute phase of the infection.
feces and urine must be disposed of safely.
Surgery in complicated typhoid,
Surgery if intestinal perforation,
by simple closure drainage of the peritoneum,
small bowel resection if multiple perforations,
cholecystectomy if unable to eradicate hepatobiliary carriage,
diet plan in typhoid,
electrolytes imbalance to be corrected by drip infusion, increase intake of liquids and fluids,
avoid junk and oily or fried food, soft digestible diet plan like fruit vegetables, bedrest, advised to stay home until fully recover.
As relapse can occur, monitoring for 3 months.
Up to 10% can get it after initial recovery.
Second or third relapse in rare cases. although relapse are mild in nature.
3-stool culture with a month apart is advised to rule out carrier state. Urinary cultures could be advised in exceptional cases. Patient's education. Hand washing. Vaccination.
Staying away from contaminated foods and beverages. The US Centers for Disease Control and Prevention dictum.
Boil it. Cook it.
Peel it. Or simply forget it.